The events leading to my dismissal began weeks before August 25th. On August 2nd, I learned from media reports that experts serving as liaison representatives to the Advisory Committee on Immunization Practices, the ACIP, including those from major medical societies, had been removed from its working groups. The following week, I heard concerns that the ACIP might alter childhood vaccine schedule at its September meeting, potentially without credible supporting data. On August 8th, a gunman, driven by vaccine distrust, fired 180 rounds into CDC headquarters in Atlanta, killing Officer David Rose. In the days after the attack, I focused on security, staff, and ensuring the CDC could continue its mission. On August 19th, I received a directive from the Secretary's office. I now required prior approval from my political staff for CDC policy and personnel decisions. On August 21st, I was told to return to Washington from Atlanta immediately, which would have meant missing Officer Rose's memorial, something I was not willing to do. When I did return, I was concerned about my ability to continue to lead the CDC while preserving evidence-based decision-making, commitments I had made to this committee during my confirmation hearing. On the morning of August 25th, Secretary Kennedy demanded two things of me that were inconsistent with my oath of office, the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts. He told me he had already spoken with the White House several times about having me removed.
My name is Dr. Rubin, and we have a big problem happening in the next couple of days, which is that the Advisory Committee on Immunization Practices is going to meet, likely going to try to roll back certain recommendations restricting access to vaccines. However, the good news is that AHIP, which represents about 1,300 health insurers in the United States, issued this press release to try to reassure folks that they will continue to cover all ACIP recommended immunizations that were recommended as of September 1st, 2025, including for COVID-19 influenza, with no cost sharing for patients through the end of 2026. Even your health insurers, which do everything they can to cut costs, will be covering vaccines because the cost-benefit analysis is clearly in the favor of vaccinating the population to reduce the chances of people getting severely sick.